My name is Pat Iyer. I've been a legal nurse consultant and helped attorneys with over 100 emergency department medical or nursing malpractice cases since 1987. The emergency department is one of the highest risk areas of the hospital. In this video, I share tips on some of the problems that affect emergency department care. First, the nurse who performs the initial assessments of patients, called triage, can get overloaded. The work intensity can suddenly spike in the emergency department. A patient is in cardiac arrest and needs to be resuscitated. A patient suffers a major trauma after falling through a roof. An infant is gasping for breath because of croup. What happens if all of these patients arrive simultaneously? The triage nurse has to be very assertive, knowledgeable, and comfortable with the role of expediting patient care. The triage nurse also has to be able to say, "I'm one person, I can't handle this alone, I need immediate help," or "We're overwhelmed and something might happen because we can't get to all of these patients." All hospitals have to have a backup plan. The plan applies not only to triage, but also whenever there are more patients than can be comfortably handled by all of the emergency department staff. For example, there may be one or two emergency department doctors. Is there a plan for when that doctor becomes overwhelmed? Can the doctor call in another doctor? The ED may need to notify resource and rescue squads to stop transporting patients to the ED and divert them to other locations. The first problem leads to the second problem. When the triage nurse gets overloaded and can't get to all the patients in a timely manner, a critically ill patient can die without getting attention. When a nurse friend of mine developed laryngeal spasms, her friends took her to a large Philadelphia inner-city emergency department. There was a glass window in the waiting room and a metal tray for collecting slips of patients with the patient's chief complaints. My friend wrote her chief complaint was "can't breathe." She waited 15 minutes and no one ever approached the window. A patient standing outside told her the name of another emergency department where she would get faster care. She got in a cab and found out the cab driver did not know where the other hospital was. After he dropped her off at the wrong corner, he drove around the block and came back to take her to the emergency department entrance. There she was promptly triaged and treated, and fortunately the spasm stopped without ill effect. If the triage nurse is with a patient or not at the triage area, the patient should ask the hospital employee he sees for assistance. If there's a phone present in the reception area and no one is available, the patient can always pick up the phone and dial the operator and advise her, "I'm in the emergency department and I need medical assistance." I discuss more liability issues associated with emergency department care in my new book, Analyzing Emergency Department Medical Malpractice Cases. I wrote this book to assist legal nurse consultants and attorneys who handle emergency department cases. Get ordering information at the link below.